Okay, guys, here we go. All right. So in the news, we have Pelosi falling down a staircase, right? And breaking her hip, which is a very serious, um, um, extremely serious surgery, or excuse me, I'm sorry, extremely uh, serious trauma to your body. I'm sure she was probably had more uh, things than just the hip that was fractured. I'm guessing, hang on one moment, that she really suffered. And I kind of felt bad. And I thought, well, this is going to put a damper on her career, blah, 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 right? I'm thinking this to myself. Then I find out today that she's at a military hospital in Germany getting a hip replacement. I'm like, oh, fuck. Do you guys realize? I mean, I've worked in medical devices in Munich. Do you realize the German um, surgical implants are so precision and so far above anything that would come out of the United States? And she probably is having something custom thrown together for her too. Which in Germany, as much, everybody's a Nazi, right? Well, not anymore, I guess. I guess they denazified Germany. But I mean, everything is so precision and the craftsmanship is so intensely high. I used to sell back in the late 90s surgical scissors used to cut, to graft veins for heart surgery. And I mean, I had a sample of one after, I stopped doing that and went to, I was a manufacturer's rep. So, uh, without going into detail, okay, so afterward, I had a few um, samples. And I mean, there was one that I used for like 20 years just to cut really fine things. I just never, eventually there was a little screw in the middle and it came apart. But I mean, it's just fucking Failing was the name of the company, Fehling, and they were made in the Black Forest. Their factory, or the people that hand sharpened them in the Black Forest in Germany. Okay, and I mean, if you're not a rep, you're not going to get it. But I'll try to explain it to you guys. I'll try to explain this without losing my entire audience, and I might get about 40 views here. So we have this CEO healthcare shooting because claims have been denied. In any normal circumstance, if Nancy was just average Jane or Joe, who took a fall in the city, like in Milwaukee, and they just had standard Medicare and a supplement or Medicaid, God forbid, like Title 19, government, which a lot of people have because shit's gone so overpriced. It's easy to get because you just make a phone call and you just send in a checking account balance and that's it, right? So, but Pelosi, oh no, she's transferred to a premium medical facility in Germany and she gets a total hip in Germany. I mean, whoa. And I thought, well, and you guys, if you're not a rep, you might not understand it. Okay. Well, I know you won't. You'll think, oh, yeah, okay. Yeah, I guess it must have been really bad. Nope. Nancy got, instead of just having a couple screws put in and sticking her in a nursing home, and then, in and out of the nursing home until she croaks at age early 90s, maybe 92 or something, Nancy got the precision German hip. And if you think, oh, it's a U.S. hospital, it doesn't mean shit. Believe me. There are ways around not supplying US made equipment, especially with her. She's got millions and millions. It's probably worth a couple bill, you know. So she gets not only the Cadillac, she gets the Boeing jet of treatment. And I guess what kind of pisses me off is that when Obama was running for office and he kept talking about Obamacare and all this shit, and it's really coming to fruition now. Well, if grandma, like if she needs a total hip, and maybe it's just be better to give her a pain pill. And that's another thing. You can guarantee it. No one's denying her pain medication. The entire time I'm laying there crushed by a fucking 6-ton Dodge Ram. Well, the government won't let us prescribe for you, for your type of case, for this type of fracture, even though it was a different type of traumatic fracture than just falling. I was run over by a truck. And I kept hearing this over and over, and I was so mad, when I would hear it. And I would usually just roll my eyes because I was so sick the whole time. Although well, I could get into details, but we'll do that another time. But so I had everything crushed in that area, the pubis ramus, the acetabulum, the hip, plus my entire iliac crest was pulled apart. And all they did, I don't know what they did, but they totally dismembered my body. I know dismemberment sounds weird, right? It's completely disfigured. And I had to avoid revision surgery because of this fucking trial that I had, which I want to talk about, but my civil attorney says don't post anything on social media right now. And I'm just going to try to figure out if I can at least get something up here without using names, locations, and shit like that. I mean, there's got to be a way I can do it. But he's freaking me out. He doesn't work past like 3 o'clock because he takes his daughter to dance classes. I mean, this is crazy. And I told him, I said, my gut feeling tells me to run as fast as I can from you right now. Oof. Well, he called me back right away then. It's like always an excuse. And then it's like, have a great week, an exclamation point. And I'm sitting there on crutches in extreme pain, thinking to myself, are you fucking kidding me? Fuck you. Excuse me. So meanwhile, we have Nancy. And honestly, I can honestly tell you this, if this would have been pre-Obamacare, I would have been treated a lot better, actually, because of the protocols put in place. They type in a code for the fracture and that's it. I've got the codes. And it's just, okay, it's a trauma. This is what's broken. Not taking into account any other detail of it. So this bitch, now this is just for the average schlep, pardon the slang. So patients who have broken a bone, treated surgically, cause of a hip fracture, okay? Metal hardware usually can be left in, even, check this out, even when you've developed sepsis, have an abscess that it has a 100% mortality rate if not caught in time. I was wondering why they were acting so worried about me. I mean, I was just so out of it that if anybody came near me and touched me or moved my body even a centimeter, I was screaming because it was that bad. And they couldn't figure out, well, I kept telling him, I said, look, if you send me home like this, I'm going to die. And someone took pity on me and actually did further testing and said, oh my God, okay, you're right. There is something wrong here. It is really bad. And we need to get you to a better hospital to have this thing treated because it's serious. I'm like, well, I fucking know that, this is what I'm saying. But for Pelosi, okay, now if it was just like me or you, now this is an 84-year-old woman. Don't forget what Obama said. You know what? I'm going to go even a little bit further with this shit. Let's go into YouTube. Okay. Oh, can we just Fucking bullshit. Let's pull up YouTube. Yandex is in the toilet right now too. And let's have some fun. If my internet is fucked too. Okay, so let's do this. Excuse me for a sip of water. Winter vehicle warm up. Yes, they're gonna steal your car because you let it sit out there. These people are so fucking stupid. Just another time, right? Okay. Well, we could have just done a regular search. Grandma can take a pill instead of, I'm just trying to think of what he said. Okay, he used the term surgery because he doesn't know his ass from a hole in the ground. This cocaine snorting, pot sniffing fucker who doesn't know shit about the human body is having people make rules that just have simple degrees in public health, right? That don't even treat patients or see patients in or even do surgical procedures or anything like that. Well, they might be able to do surgical procedures, but just a public health degree, that's someone who shuffles numbers, right, to save money. So you have someone like Hussein Obama, and I don't care if he's Muslim, I don't care what the hell religion you are. Well, some of these, never mind. I mean, there are a few religions that I find to be a little on the odd side, i.e. like Satanism, stuff like that. Yes, I know about Tampon Tim and his display at the state capitol. Okay, so now my fucking internet is, fuck you, Obama. Set up your own rally. Like he does anything, right? My internet is really fucked. I can't believe it. And it just depends on what part of the apartment I'm in, and I'm closer to where never mind. Can take a pill. YouTube is just so sad instead of surgery. What was that, 2008, I think? Yeah. Maybe you're better off taking painkillers. All right, let's start here. I should have had this pulled up, but I just didn't think of it. I should go on my Brave browser. This is just sucking. All right. Oh, for fuck's sake, come on. He was in a rally. I remember that. All right. Well, give it a minute. Stay with me, please. Don't leave.
She's 105 now, over 105, but at 100.
So you guys are saying, well, 105 is different, right?
100, the doctor had said to her, I can't do anything more unless you have a pacemaker. I said go for it, she said go for it, but the arrhythmia specialist said, no, it's too old. Her doctor said, I'm going to make an appointment because a picture is worth 1,000 words. And when the other arrhythmia specialist saw her joy of life and so on, he said, I'm going for it. So that was over 5 years ago. My question to you is, outside the medical criteria for prolonging life for somebody who is elderly, is there any consideration that can be given for a certain spirit, a certain joy of living, quality of life, or is it just a medical cutoff at a certain age?
And we're not going to solve every difficult problem in terms of end-of-life care. A lot of that is going to have to be we as a culture and as a society starting to make better decisions within our own families and for ourselves.
What the hell are you talking about?
But what we can do is make sure that at least some of the waste that exists in the system that's not making anybody's mom better, that is loading up on additional tests or additional drugs that the evidence shows is not necessarily going to improve care, that at least we can let doctors know and your mom know that, you know what, maybe this isn't going to help. Maybe you're better off not having the surgery, but taking the painkiller.
Ugh, I hate this guy. I really do. I can't begin to tell you how much I dislike him. And this Obamacare thing was always a big, huge, bleeping, fucking hoaxy thing. I just also wanted to mention while I'm at it, Chris Rock clearly has cheek implants and Botox. I didn't even recognize him. These cheeks, what is he, like 50 something, 60 something? I don't know. Maybe he's younger, but I never even recognized him. He's definitely had a shitload of plastic surgery and for sure has, I don't even think it's cheek filler. It is cheek implants. Okay. So here they are, the left right now, saying, well, let's shoot and kill the This is, I don't mean this. I'm saying this is what you're hearing, that the United Health guy deserved to die or whatever. Okay. But what people don't understand is that, he's just a paper pusher anyway. And there's more to that story. But now the trendy thing is to go against health care again, the same way that was being done in 2007, 2008, when Satan was running for president. Okay. And there are use an inhaler. Obama. Let's go back. Let me try to get through this. For some reason, I'm having on and off problems with headaches, and I'd love to take a pill, but you won't get one. Let's go Obama. Yeah, let's try to get this. You see what an Obama rally? I'm asking you to keep believing in me. Keep believing. Obama has a book thrown at him. That's cool. I'd almost enjoy that. 2024 treatment protocol. Ugh, I don't even know if this is going to get up. For 84-year-old hip fracture surgery. You see what I'm saying? This is so right out there in the open, but no one's catching it. Immediate versus delayed surgery for hip fractures. In patients aged 60 years or older with acute hip fractures, what is the impact of timing of the surgery on beneficial or harmful outcomes such as mortality, functional capacity, quality of life, or perioperative complications? Well, I had a complication that has a 100% mortality rate. I've got to find that article. It's just, I'm sick of talking about it. Now they're talking about just giving a spinal anesthesia. You guys, I have sat through many hip replacement surgeries. They're very bloody. That's the first thing. So she probably had a hang on, I'm just grabbing water. I wouldn't doubt it if she had a couple of blood transfusions during the surgery, or at least one, because being her age, I don't know what kind of medication she's on. You lose so much blood that you have to actually have a suction thing to get the blood. And sometimes they use spinners to put any lost blood back into you if you need it done. For me, I got 2 transfusions and they had to stop everything during a 5-fucking-hour surgery. And I specifically told them I did not want any Vaseline blood. And I saw the handwritten notes, but they probably just laughed and gave it to me anyway. I mean, how would they even know? That could have even been where I picked up the MRSA and the sepsis. It could have been there. At first, they were blaming it on me. They said, "Is your bathroom clean?" Yeah, yeah. No, your hospital, your surgery gave it to me. The fucking hardware was infected. These people don't even wash their hands. The whole table was probably infected. I've been in the OR for 17 years. These people are such assholes. Perioperative goal, directed in therapy and geriatric hip. You guys, I don't know if her 85th birthday is coming up or not, but for an 84-year-old woman who had a hip fracture, I don't care. You guys would say, well, it's probably really bad and she needed it. It doesn't fucking matter. For me, they would have had nowhere. They could have probably put a new hip in, but it wouldn't have had anywhere to grasp into, really, because everything was smashed up and connected together and smashed up. And now they're talking about just giving you a spinal anesthesia for a surgery like that. You guys, that is so fucking bloody and saws. And I mean, someone told me, my boss made me, he used to sell custom. They used to do custom. They wouldn't put an off-the-shelf hip in you. I'm only going back to the early 90s, where they would, if you were getting a total hip replacement, you'd look at the options of the different features of the hip, depending upon what was wrong with you. And then the rep would go in with the surgeon, have x-ray copies made, and then the rep would send the x-rays to the company, and the company, based on, your height, weight, etc., bone type, how is your bone stock? Do you have osteoporosis? What do you have? And they would custom make a hip and put it in later. But to give that type of an expensive surgery to an 84-year-old woman, it's not normal practice by any means. Okay. And you could probably sell a couple of screws and a plate. To be honest with you, the company actually marks shit up, the manufacturers do, and then they mark shit up to the hospital, and then the hospital marks it up to Medicare, plus they pay a standard surgeon fee, that's based on Medicare too. So at the end of the day, you've got, maybe, I don't know, $2,000 worth of hardware in there, marked up to Medicare, right? So, I don't know how to describe this. So if we paid $100 per screw and sold it to the hospital at like $110 per screw, the hospital would take that and then bill the insurance company like $800. So you're looking at, for a couple of percutaneous screws going through, or a plate or something, not that much. The surgeon's fees are all exactly the same. The surgeon can mark shit up if you have really super good insurance, but see, Nancy's on her government plan, right? Nancy's not on Obamacare. So keep following me. Innovative hip fracture surgery techniques. A comprehensive rehabilitation program. Oh, yeah, right. AAOS management here. This is the American Academy of Orthopedic Surgeons, and these guys are such dicks. But it's AAOS, which is very, it used to be prestigious to be in there. See, I don't know if I'll even be able to get in here because this could be a doctor-only site. Fine. You rely on guideline. Yeah, what? Okay, can we read the article? Probably not. Moderate evidence does not support routine use of preoperative traction. Hip fracture surgery within 24 to 48 hours may be associated with better outcomes. Venous thromboembolism prophylaxis should be used in hip fracture patients. Blood thinners. either spinal or now they're doing spinal. Oh my God. Or general anesthesia is appropriate. Oh my God. Wow. Arthroplasty versus fixation. In patients with unstable displaced femoral neck fractures, arthroplasty is recommended over fixation. So that would be, the hip replacement. Unipolar, bipolar hemiarthroplasty in patients with unstable displaced femoral neck fractures, unipolar or bipolar hemiarthroplasty can be equally beneficial. Total arthroplasty. So she got the total hip. Okay, she didn't get a partial. She didn't get this. She got the whole thing. In properly selected patients with unstable femoral neck fractures, there may be a functional benefit to total hip replacement over just a little bit of at the risk of increasing complications. Let's look up hemiarthroplasty, right? Okay. If my computer will let me. Are you guys even following me? Okay. Oh, I forgot it. Okay. Hemiarthroplasty is an operation that is most commonly used to treat a fractured hip. The operation is similar to a total hip replacement, but it involves only half the tip. Okay. Well, I guess so. It's also chronic joint. This is more of a so let's just do this. How much does it cost for a hip replacement? Okay. See, I've never heard of or worked with patients that had total hip replacements because they broke their, and needed emergency surgery. It's a little bit unusual. But see, she's got the premium plan, right? How much does it cost for a hip replacement? That's in Great Britain. U.S., United States. Okay. 39.8 prices range from $18,175 to $53,570. The biggest factor that affects what you pay for your hip replacement is where you have the procedure. Right there. Where do you have it? Inpatient facilities like hospitals typically charge more than outpatient. So most people are just doing outpatient surgery. They usually have osteoarthritis or had a fracture, were younger or had something go wrong somewhere along the line. And their hip became basically bone on bone, developing arthritis, rheumatoid arthritis, that type of thing. Hip replacement without insurance. Hip replacement cost by country. Do you think we're going to get anything out of this? And I honestly have not, with these headaches I've had. If I told you, it's because I was around someone that was heavily vaccinated with RSV, the Spig C, and the flu, and so many people are getting sick. So obviously the United States is probably, it is the highest cost of surgical intervention. And I honestly, I think that you would be almost lucky to be in a hospital in Germany, at a U.S. hospital in Germany with oh my God, with the new technology and the training and, the implants there. I mean, she's getting premium care that would not normally be given to an 84-year-old bag that fell down and broke her hip. When I at first heard about it, as I said, I was like, oh my God, I felt concerned and worried. But when I found out how they were treating it, and she's still in the hospital. And instead of being shoved into some shitty ass nursing home, then being sent home and using a walker and being basically left to die you know, uh, she's getting it all so she can be back in her high heels. That's another thing. Why the fuck would a 84-year-old bag be wearing high heels? I saw her. I saw a picture of her in that place before she fell, and they all had, some of them had glasses, like little plastic type drinking glasses, but they were probably having some wine or a cocktail or a beer or something, because honestly, they drink in the hospitals in Munich that I saw. They have vending machines with bottles of beer in them, and not just one or two on every floor of where hang on a minute. So normally for someone like Nancy on shitty insurance, on Obamacare, let's say on Obamacare, there is no way she would have had that. Let's get rid of this. Now, if she would have just had fixation, oh, for Pete's sake, hip replacement without insurance, put it this way, for her hospital stay, let's lay the cards on the table, several $100,000 because of the treatment she's getting. And I can guarantee you no one is turning her down for any pain med requests or anything like that. Because I know, and you know what? It's hard for me to feel sorry for Nancy because I know she's going through a lot of pain. But the liberals aren't putting this one together. They're not saying, okay, so Nancy's getting all the special treatment in the Cadillac of care, but we're going to bitch about this United Healthcare CEO. But she's the one that kept Congress open till like midnight on like Christmas Eve to pass that fucking bill. The average cost of hip replacement is $32 to $45. It's too. I mean, she probably needed a hip replacement anyway. Well, let's just jump to it, right? I'm not going to really find anything on any of these fucking searches. I'm really not, because you know what? The internet searches are dead, right? Honestly, Elon Musk is talking about doing like Xmail versus Gmail. I'd be all for it, but it would have to become more mainstream and attached to, your YouTube account and all that shit. So if we go here, treatment protocol for an 84-year-old. Oh my God. I don't know. Okay. Okay. Wow. Immediate. Okay. So treatment protocol. Optimal hip fracture treatment for the elderly. What are the surgical options available for treating hip fractures in the elderly? Hip fractures. Optimal fracture treatment for the elderly. Hip fractures are a big worry for seniors. Clinical practice guideline. Oh, here's a good one. This is a public med site. Oh my God. Oh my God. I swear. Things just keep getting worse, don't they? The annals of rehab medicine. There's a library. Okay. Clinical practice guidelines for postoperative rehab in older. That's not even what I asked for, is it? I can tell you that if Nancy was just an average Medicare with a sub patient, she wouldn't be having the treatment she's having. And that is because she's on the government dole and she gets special treatment. Let them eat cake, right? The guy, okay, introduction. Hip fractures are common among older adults, increasing incidences. The hip joint is located between the proximal femur and the acetabulum. A hip fracture refers to a fracture in the proximal femur that can be divided into the femoral neck, intratrochanteric, and subtrochanteric fractures. Hip fractures are classified as an intracapsular or extracapsular fractures based on the relationship between the fracture site and the hip joint capsule. Since the joint capsule starts at the femoral neck and connects to the pelvis, femoral neck fractures are intracapsular, while intertrochanteric or subtrochanteric fractures are extracapsular. As a period of mobilization after surgery increases, previous comorbidities worsen and new complications are likely to occur. Therefore, early rehab treatment is essential for promoting postoperative recovery. In other words, they want you to try to walk on it as soon as you can. All right, and get movement back in the joint. So I just, I can't, I really, this is such bullshit. Okay. Oop. Did final, I think it was on Christmas Eve, right? I think there was one person. Was this 2010? Was this 2010? Yeah, I believe so. Well, this was what really put the nail in the coffin for the U.S. Pelosi announces a Christmas present. Right? How Nancy Pelosi saved the Affordable Care Act. Oh! But see, she's not on it. She blamed the white male thing for all right, for 2010 midterm loss. If anyone loses when you're a Dem, you're a racist, you're a Nazi. The Nazi thing was just all over the place this time around. I get phone calls. Donald Trump is a Nazi. I mean, this is what used to happen to me. And now just even trying to get information, now I have to sign in or register? You got to be kidding. Flashback. I should go into, do a more professional one of this one. Pelosi announces Obamacare as a Christmas present to the American people. Oh my God. At last, America has found in Trump the return receipt. After an entire summer of protests, Obama, Pelosi, and Reid were determined in late 2009 to set the groundwork for shoving. Okay. We were enjoying that too. Shoving Obamacare down the throat and up the ass of every American who never liked or wanted it. You can keep your doctor. Remember those late 2009 special sessions in which Democrats planned to push through as much of the Obamacare monstrosity as they could before January 2010 special election en masse? Oh, okay. So that was blamed on white men. Pelosi noted that this work, completely devoid of any GOP support whatsoever, will result in a Christmas present for the American people. But see, right now, she's got her own Christmas present going on in Munich, and I'll bet you she's even have a glass of wine or a vodka on the rocks in bed. This woman is insane. Now, isn't it weird how she looks younger now than she did then? Of course, my computer is locked up. Pelosi noted that this work, okay. Cripes. I don't know. I don't want to have to move because I'd have to get the crutches going and all this. All right, let's try. This should take a good hour, but let's see what we can do.
I'm confident, I'm hopeful that we will have a bill as a Christmas present to the American people.
What the fuck? Oh, okay. So I never would have made you sit through all that for an 11-second video. This was definitely not the American people's Christmas on the American people's Christmas list when the economy was in the tank. People were dropping like flies out of the workplace, and the Tea Party was being ridiculed, othered, and silenced. They plowed ahead. The messaging was just bad. Obama didn't give that special 1 millionth speech that would have really sold it. You know, he promised to put everything on C-SPAN, every single aspect of every single bill, and have it reviewed by the American people. He also promised to take every lobbyist and kick them out of Washington, D.C. Okay. One of the most infuriating images of 2010 was to me Nancy Pelosi striding toward the Capitol building to vote on Obamacare, hefting the 1965 Medicare gavel, head thrust back in silent, gloating cackle. Yeah, she's insane. This was the mere months after Scott Brown had been elected as the 41st vote against Obamacare in January 2010. Hubris is still staggering. Happily, the election of Donald Trump America is finally the return receipt on this particularly horrific Christmas present. All right, let's see if we can find this. Let's maybe go to Brave here because this is such fucking bullshit. Everything is turned so sanitary online. Now I can't even get this. Okay, search the web. Okay. Okay. I don't know if I can finish this video. I really wanted to get this information out there, but this is just crazy ass, isn't it? Well, I mean, I can't believe it. My internet's working fine all day, and then all of a sudden I come to do a video, and as usual, this thing gets fucked up. Okay. And no, it doesn't have anything to do with the tabs. It has everything to do with the fact that I barely have a signal. Okay. Joe Biden. And that's another thing. We keep people like him going after 2 brain surgeries. Fuck. Fucking, I hate saying that, deal on a hot mic. Oops. I don't want that to happen. Okay, let's go. I can't believe how everything has just disappeared off the internet. You know, Susan Wojcicki, may she rest in peace, she was the impetus of this. When YouTube was purchased by ABC, I believe, Google or whatever, that was it. You know, Biden pokes fun at 2010 BFD, hot mic during moment. BFD, big fucking deal. This is a big fucking deal. Was Joe Biden swear a big deal? Barack Obama references big fucking deal. Biden says Obama laughed at his open mic gaffe. Obama calls back to Biden's hot mic gaffe. The rap. Biden care is a really big deal. Well, let's see if we can find it. It might be impossible, and I apologize for this, but I just hope you get some video. Let's do this. What is going on here? Video. Does YouTube have this or what? Answer with AI. I think we're at about 28% unemployment right now. Maybe 25. I don't think the Guardian right here. You think we'll get this? Let's try to get the volume up here. Wow. Yeah, I can't wait till this guy is gone. What do we have, like 38 days left of this fucker? Holy shit. Oh my God. I mean, this is ridiculous. I mean, Trump better work his ass off. Let's see if this works. This is when they signed the bill, right? And that they basically blackmailed people into, no one wanted this. Oh my God.
Ladies and gentlemen, the President of the United States of America, Barack Obama.
Boo! God, is he gross looking. Look at his neck and chin. Look at Obama. Do you think Biden had to do something to him?
Thank you, everybody. Thank you.
Ladies and gentlemen, the President of the United States of America, Barack Obama.
Thank you, everybody. Thank you.
Ladies and gentlemen, the President of the United States.
I don't want to have to listen to him at all. Well, okay. I hope I can get this video up. I hope you at least get what I'm trying to say. I don't even know if I will be able to load this. I'm actually almost in tears. This is pissing me off so much because I've had on and off headaches since someone viral load shedded on me. And you guys think, oh, that's so silly. No, because she got so fucking sick. She had to call into sick to work and the whole nine. And I had inside me, I thought, I probably shouldn't be around her. She's coughing. And I have avoided her. Boy, oh, this is really bad. It's really mean, but I told her. I said, and I ignored it at first, but then as things got worse and worse, this article is more than 14 years old. The vice president loose lips fail him. They're going to block this right away as a microphone picks up an Anglo-Saxon aside. Ugh, this is a big fucking deal. Joe Biden is famous for having his mouth that runs out his brain. What? No. He knows. This is like, what are you people in Great Britain? I'm getting frustrated with you. Although I did like seeing William with Trump. That was a very interesting meeting, and I wish to F that I would have known what was discussed, because I know it has something to do with Musk. Yeah, I mean, the cabinet that Trump has right now is popular with a lot of people, a lot of millennials. I don't know so much Gen Zers, but a lot of the millennials always liked Elon. And for some reason, people like Vance. I don't know why. I think he's almost going to be the Joe Biden of the Trump presidency these last 4 years, because I don't feel happy or comfortable. I didn't feel comfortable voting for him as VP. I felt worse about voting for Pence, but yet Vance was almost worse than Pence because he just was outright using foul language. Well, he's like, I hate Donald Trump. He's Nazi. Like, after introducing the president at the signing ceremony for healthcare reform legislation. Yeah, it was legislation that took over your body and is trying to kill you as we speak. You just don't know it. If you don't know it, it will happen to you. This chick that I was telling you about that was sick, that got me sick, Like things like headaches, and I've never had shit like this. And I'm out walking around in the snow on crutches with spikes on the bottom of my shoes, I've had a lot of weird stuff happen to me, since, well, just whatever. Okay. I just don't like to be around freshly VAXXED'd people, you know? Oh, yeah, I got the RSV. I got the, I didn't get the live virus, But then she says to me, and then I won't even tell you, her daughter in law had 5 in a row. Within 3 days, fell to the ground and has myasthenia gravis right now. And was sent to a hospital where they forced her. They said, we will not treat you unless you sign a preemptive. We are allowed to put you on a ventilator if we feel we need to. And she's like, yeah, okay. She was on her way to China for a teaching gig. Remind you of anyone? All right. Joe Biden is famous for having a mouth that runs, out of his ass. He speaks out of his ass, but in Great Britain, it runs from his brain. He doesn't have a brain because his brain was taken out by a doctor. His words, not mine. And his doctor had the brain in his hands. And brain material. I mean, this is Joe Biden, though. He said this. It doesn't even make sense, although it could. The vice president was caught exclaiming in no uncertain terms on live national television after whatever. Biden turned and embraced his boss while excitedly whispering into Obama's ear, "This is a big fucking deal." And you guys, it was very much noticeable when it happened. I mean, it was not. No, you could hear it. This is insanity. This is a big fucking deal. Loudly enough to be picked up by the cameras. Yeah, it was very legible, Fox News was the first to pick up on Biden's blooper. Was it a blooper, though? And repeatedly ran the clip. Yeah, they did. Above. Of course, it's been deleted, right? I'd have to go on Internet Archive to get it now, which is really sad, too. Hang on a minute. Oh, okay. Oh, well, Fox News, how dare you run that clip of Obama, or excuse me, of Biden and our saint Barack. He's lost melanin in his face. I know his hair is gray now, but his skin tone is very sallow. There isn't any melanin left in him. He is 50% white. Biden isn't the first president to resort to old-fashioned Anglo-Saxon expression. Can you imagine if this would have been Trump or Vance? I'm telling you right now, I am not comfortable with Vance. He took a picture of Melania and on the Daily Mail, and then he posted on his fucking Twitter. And the Daily Mail, let's see if I can find this. Daily Mail. I mean, okay. Oh my God. Okay. Whew. I mean, this is such bullshit. JD Vance, Melania. I don't know. Melania hair extensions. Yeah. So expert people came in. There's like 400,000 people in this country right now. Okay, so this should take a good 15 minutes, but if you're just forward it if it doesn't come fast. J.D. Vance exposes Melania Trump's hair extensions as experts reveal how many inches she has. Now, she's always had the same length hair before extensions were popular. And now, I mean, I've had hair extensions, just not for a while, just because I just decided not to do it. Because they're hard, actually, for me, hard to take care of, because they get, they're just, yeah, I don't know. I just decided against it. How's that? People are clamoring to know if J.D. Vance put up a picture. Okay, he shared a photo on X, previously Twitter, on December 12th showing the back of Melania's head. It appeared to reveal a piece of her extensions. The hillbilly. All right, so here's the deal. They could manipulate this too. This keeps looking more manipulated. It looks like one, and then it's on the ass, on the tips, they look lighter. And it's long and it's full. And honestly, okay. Like, you think Ashley Biden wears them, Jill Biden wears them, and Michelle Obama is running around with braids at age 61. She thinks with, like, are there seashells in there too? I mean, it's just Michelle, that's not just FYI, Daily Mail, Michelle Obama and her braids, that's not natural hair. She had a weave put in there. Oh, I can't handle this. It's like, okay, I can't handle my internet at the moment, but let's end the vid. And he rang the bell at the New York Stock Exchange. And honestly, I've read this article. It looks to me as though some of these photos have been photoshopped. I doubt that he went on with his hair looking like that. But I can't actually really use my internet right now because it's just basically like barely working. Okay, here we go. Okay. What fans are saying to Chris Rock? He definitely has hair, cheek implants for sure. Okay. Well, let's see what we can do. I'm gonna have to move here. Yeah, or I'm gonna lose the whole fucking video. I hope you guys get what I'm saying about this. I'm on crutches, so if this thing is still recording, I'm not taking it out, Shit. All right, so let me move. Shit. Ugh. See if this works, huh? Oh, crap. Okay, here we go. Let's do it, huh? Fucking ridiculous. Okay. Well, I don't think I'm going to be able to record this now. Well, let's try to do it this way, huh? Well, okay, so let us... Oh, here we go. Okay.